back, still Daybreak Africa, reaching in here, my very own studios in Ondo City. I'm Ezekiel Ogar. This morning, we shall be talking on Nigerian health system, innovation, collaboration, critical to strengthen and sector. Well, before we go into that, quickly, the Nigerian Medical Association says innovation, collaboration and relentless commitment to equality will strengthen Nigeria's health system and reshape the future of global health. Its first vice president, Dr. Benjamin, said this in an interview with journalists just recently. Dr. Benjamin said that Nigeria must rethink its approach to medical education and research as it explore opportunities for health innovation. Now, who best to talk on this topic if not our very own Dr. Modupe Olubusayo, as we discuss the issue of innovation and collaboration in order to strengthen Nigerian health system. Welcome on the show, Doctor.
Thank you for joining us this morning.
It's been a while.
On the show. Yeah. Well, going straight to the point, firstly, I would like to get your perspective as to where you see the health system of Nigeria currently. What are those challenges, major challenges they've been facing?
The health system in Nigeria, to be honest, is in a very terrible state. That's just the truth of the matter. From human resources to equipments, instruments within the hospital, also in very poor state. Then the linkages between rural health care and urban health care is virtually almost non-existent again. If the cost of healthcare services is almost getting out of reach of ordinary citizens, that is exactly where we are currently.
Let's talk a little about innovation in our healthcare, especially. I know we talk about our healthcare system, we then talk about lack of human resources, probably lack of, I think, more like budget. We're coming to budget at some point. What exactly, what then is our market gap per se? What is our actual market gap? Because I know every sector has to be productive, every sector has to be marketable. So what then becomes the market gap for the health sector? And are there any innovative solutions to that problem?
As regards the general, because of the current situation that health workers leave the country in groups, that's no more news now. Although currently it has reduced.
Are you sure you're trying to be nice this morning?
It has reduced.
Okay.
Why? Because the exchange rate is also very terrible. To get, if for example you are looking for 10,000 pounds or 13,000, well, that's some very huge sum of money, and it will be very difficult to get that in Naira. And so the exchange rate technically has limited a lot of people leaving the country. Just few days ago, probably a couple, they were supposed to live together. Now it's only probably the wife that left, so that one will work in and earn pounds, so that the husband will join. So the major challenge, of course, it's human resources for health. And for innovation, the simple thing is what we call telemedicine. Telemedicine. And what it simply means, technically in Nigeria, we started using a little bit during COVID. People were able to talk with their doctors despite the fact that they are not together. Although, of course, that is easier and better for stable patients. But you won't, for a patient that is not stable, you can't do telemedicine. That is, we are not together, because that means I need to examine, I need to check a lot of things. But for somebody who is stable, of course, you discuss on phone, it can be video, it can be anything. That's what we call telemedicine. You talk, how are you doing, any complaint, any side effect with your drugs? Yes. Probably yes, you are managing the person for BP. What's your current blood pressure like? I mean, that person has a machine that he can use to measure his BP. Or you are treating somebody for diabetes mellitus. Of course, what is your last blood sugar? What's your fasting blood sugar? You are not seeing the patient, you are talking through all this new media. That's telemedicine. I think that's a major place we are moving to now, because it's going to assist a lot.
Well, with over 70% of Nigerians relying on out-of-pocket health expenses, what reforms would you actually recommend to expand health insurance coverage?
Now, for those who are, when you talk about healthcare financing, in Nigeria, we are used to out-of-pocket payments. And that is a major challenge. Do you know currently in Nigeria, health insurance is no more optional. It is mandatory. But the challenge is, are we buying into it? That's the challenge. You notice there's national health insurance. Virtually all states now have their state health insurance. We are in Ondo State. We operate national health insurance. And there's also Ondo State Contributory Health Commission, which have different programs. The Abiamo, the Oranges, that's for former sector. They are all forms different, and even there are private schemes. Currently, if you have a copper in your organization, they are enjoying health insurance, national health insurance. Immediately you are posted, they are registered. Every state has their own health maintenance organization. And so, for a copper, you get sick, just go to the hospital, you are treated. Most tertiary institutions, we call it T-ship for tertiary institution. Once the school is linked to one health maintenance organization and the student register, if he's sick, of course, go to the health center first. If it's something the health center cannot handle, they refer to another hospital. But the truth is, we are not buying into it. So they go, yes, if there's a law, there's an act, I think it's 2022 Act, National Health Insurance Act, making health insurance mandatory, compulsory for all citizens.
Now, what do you think is responsible for people not accepting it?
One, I think, is knowledge. One. Then again, you know, most of us tend not to believe our government. It's not possible. But for those who have been using the health insurance, they understand. You know, it started with a federal worker. And they have been on it for a long time.
Yeah.
It's now the states are joining. I'm a state civil servant. I have health insurance. I can access care. I don't need to, if I have malaria now, I don't need to go and buy medicine by myself. Just go to the hospital, allow a doctor to see me, they make prescription. I go, I collect my drugs and go home. For hypertensive, diabetes, all these things are all covered under health insurance.
The last time you were here, you did mention the fact that our government tend to be reactive and not proactive, especially when it comes to medical situations. Is this as a result of lack of collaborative strategy? And how has our collaborative strategy been so far? I mean, considering, say, from the last 2 decades, the last decade, and presently.
The truth of the matter is that the government alone cannot handle matters relating to health.
But they hold bulk of the responsibility. We could attest to that.
Well, they may.
Okay.
But most importantly, they are supposed to give direction, set policies, set the work environment for NGOs, for multinationals, for community to try to support the health system. It's so simple. Yes, government has a part. If, for example, I talked about health insurance, the government made a law, an act of the National Assembly that virtually most people they are not aware of. But you know, a lot of private businesses have registered their staffs for health insurance because they understand what it means for workers to be in perfect state of health. If you are not okay, you'll probably not be on the show. If I'm not okay, even if you have extended an invitation to me, I'll tell you. Even if I promise I'm coming, I just say, well, I'm not feeling fine. It will be bad if I'm here and you are the one who will start to treat me. You understand? So the government just need to make the work climate perfect. Then others will support. Yes, the government has a part. Making law, making policies, setting the framework. But all others, NGOs, community, private organization,
now, away from policy reforms, although we are getting there in the beat, away from policy reforms and NGOs wanting to go out there and help. I mean, NGOs are always there to really help, with or without maybe the government's help or collaboration per se. But what then becomes the strategy, the indices, the plus, the minus the government are to do to probably encourage more NGOs, to encourage more persons to join hands with them and do things as this?
You know, if there's a framework, which is the responsibility of government, this is what we want to do. Now, I love to talk about HIV program a lot because I'm directly involved.
Okay. Yes.
virtually the HIV program is sponsored from America. This has been on for a long time. Right from the beginning, although now American government is talking about this country taking possession of what they have been doing. That's where we are, because they have been supporting the program for quite a long time. There's a direction. There's a direction of the WHO. Of course, most of the time, most countries key into that direction. And so, understanding this, implementing partners, because there's a framework already, flow into it. The same thing with TB. TB program is sponsored by a foundation, not a Nigerian foundation. And so that's why you get there, the testing is free, the drugs are free. Moving in. Other diseases, for example, have we developed a framework? I'm talking about government. What is our plan for this? I know, for example, Lions Club, they are interested in diabetes. They are interested in vision. They are interested in childhood cancer. Those are three of their core projects concerning health. Okay. They want to prevent loss of vision. What is the framework the government has provided? So naturally, if the government has set a goal, this is what we want to do as regard vision. So Lions Club, for example, can key into it. Okay, yes, we have a lot of things we want to do. We will pick this screening. We will pick this creating awareness. We will pick this. I know another, I think polio, Rotary interested in that. Yes, this is, of course, this is what we want to do as framework. Then with this organization will, okay, we'll pick this. So what it means is this: if it's for health awareness, creating awareness, the government knows there's an organization, an NGO already working on that. Yes, we have 4 other things to do. One is out of it. That means it's either the government will continue with the other 3 because another organization is helping with one. So what the government really needs to do is to set framework for others who are able to join in and support. The truth of the matter is that, of course, even if all the budget for the year, and which is not possible, is given to health system, it might not be enough. And but the truth of the matter is, it's not even possible for every expenses for the year to be for health. We'll just be deceiving
with
ourselves.
every effort people trying to put into the health sector, it's more like little is being seen. At this point, before we go for our short break quickly, I think what indices could one use to really measure the success of our healthcare system? Because I know every day we talk about budget, into we talk about certain policy reformation, we talk about collaboration, innovation, but with all this that is done, with all this that has been said, we tend to measure little to respectfully no success. So how can we better measure this success rate?
The simple way, to me, to measure success is a healthcare system efficient. How long will you stay before you see your doctor in the hospital? When you get to the hospital, are all the necessary tests, necessary investigations you need to do, can you do it? Then, do you have the financial even if you can do it, you have the financial capability
I was going to ask that.
to make that payment? After this, medications were prescribed. One, are the medications available? Two, if available, are they authentic? I'm talking about genuinity. Even if it is genuine, can you afford it? Is the healthcare system safe for the staff and for the patients? Hope you won't get to one healthcare facility, you came with a particular problem and left the facility with another problem, nosocomial infection. These are simple measures, and that virtually you can answer, listeners can answer, I can answer. And so that's why, for example, you talked about health insurance. No, health insurance will cater for that investigation. Even if I don't have a dime in my pocket, I can go to the hospital because I've already prepaid, like insurance. I've paid. I can also move in to buy, no matter the drugs they have given me. Once it's under the list, it will be given. For national, for drugs, they pay 10%. Even for the state, at least I know of those states, they don't even pay 10%. And so the solution to some of it, for example, healthcare financing through health insurance, we cater for that.
All right. Before we continue with the discussion, we'll go for a break, and when we get back, we'll delve into the second phase of the discussion. So do stay tuned. We'll be right back.
Welcome back. That was GoStart segment on Daybreak Africa. We still have Dr. Olubusayo in the house as we discuss healthcare system innovation collaboration in Nigeria. Quickly, Doctor, I would like to talk about risk management. Yes, risk management. I don't know if we tend to shy from risky engagement, say probably creativity, innovation. How do our healthcare system tend to manage risk generally?
Currently, if it's about risk management, there's virtually nothing special the system is doing about risk.
Nothing special or nothing at all?
I'm just trying to
to be nice.
Yes.
Okay.
Just nothing special.
So there's nothing special at all.
So it's more like there's never been an innovation that paid off, or innovation that didn't pay off, but a lesson was learned.
There are possibilities. There are possibilities. You know, where the COVID-19 taught the system worldwide. So I'm very careful. A lot of things. Do you know, before now, before vaccine can be produced, it takes years.
Yes.
But for COVID-19, the length of everything was reduced to months. So that's a possibility that must we stay for so long before we can produce vaccine, once we know, we are sure of its efficacy.
Now, you've mentioned the COVID situation, tend to teach health system worldwide a lesson. Let's come down to Nigeria. I remember during that period, and even afterwards, you did mention we are very reactive and not proactive, and you really hoped and advised we tend to learn from that lesson, where we just try to gather ourselves before an event. Like you said, we prepare for a war before it commences, and all that. So, with that being said, have we been preparing as a nation, as our health system, been preparing towards any circumstance at all? Trying to gather vaccines on our own, even without being told maybe we have mpox, ravaging the UK and part of Africa. Are we really doing something as a health system on our own, without really looking out for who's going to help us today? United Nations, where are you? WHO, we're looking for you.
Naturally, we always try to do something. Naturally. But the truth of the matter is that there are a lot of research institutes. What is coming out of the place? Are those places being funded? Those are big questions. There's no way there can be research centers and they are not properly funded. Are universities properly funded? Those are places where researches are carried out. They are the ones that will make discoveries. They are the scientists. They are the technologists. And there are special medical research laboratories all around. What are we doing? But I think most of the time, the funding is poor. And once there is poor funding, then nothing will come out.
Funding. You started with funding. I think you want to talk about
funding.
Let's talk about funding a little bit. This budget constraints, is it more like, you did mention, actually, you said no matter how much is being put, even if the entire budget is being put into the healthcare sector, it still may not exactly make a difference. So how can it then be funding if when actually said no matter how much resource we tend to dump in there?
Because the truth of the matter is that government alone cannot. That's the issue of collaboration. There can be private bodies who are interested in researches.
But we do have them.
Are you getting my point? Have they been given the leeway to carry out researches? Naturally, I'm not supporting, many years ago, a particular doctor came out and said he can treat HIV.
Yeah, we have lots of them.
Are you getting my point? But technically in Nigeria, we tend to shut them down. It's a lie. Nobody
I mean, do you believe that?
that
You
there can be,
heal HIV?
if it's tested and it's working, I will believe.
Okay.
But that I said I can heal it and nobody is listening to me, I may have really discovered what can in my little lab. In my little lab. That could even be, did we eventually, the medication, was it subjected to any tests? But in developed places, they won't take that as a joke. Are you sure you can? They want to look into it. Yeah, it might not be perfect. That could be the final solution. They go, they get it. Now, what we use for anti-malaria, the artemether lumefantrine, technically were herbs from China. They noticed it was working. Of course, they got what the chemical that was in that herb, and of course, they started to recreate it because they now know what it contains. Right from when I was young, back of some trees, leaves of some fruits were used to treat malaria. And then really, the person will get relieved. Have you ever sat down? What exactly are the things in the back of that tree and in those leaves? But rather, we run quickly to condemn. No, it's not scientific. It's not scientific. You are using concussion. But something good. There's something good in that concussion. Of course, there can be bad things too there. Because we know there's no measurement. You just use anyhow. Of course, it could be injurious to the kidneys. That's the only thing we think about. But there's something good in it. Even in the tablets we use, are there no complications from use? Are there no side effects? So we need to just recreate our mind and criticize less and look at some of the good things in some of the little things that we can make discovery in.
If you may want to assess the response of the government towards this health sector, do you think they've actually reacted as prompt as they should, or in the direction in which they should?
I will not say their response is what we are expecting, because what they claim to be the response, are we seeing any difference? Do you know how costly drugs are now? There is a particular anti-malaria I love to take. I remember I was buying it roughly 700. The last time I asked somebody to help me get it, of course the person will buy and give me, I need to pay. with the receipt. I was afraid. For that same drug, I was made to pay 2,500 for 6 tablets that I will use for 3 days. How many people can afford that? We pity those with chronic diseases, hypertension, diabetes. Their drugs are so expensive. What is the government doing about that? For asthmatics, their inhaler, very expensive. Somebody bought inhaler, want to send to a friend that has left the country already. Inhaler, simple inhaler was 3,500. And the last time, before the person traveled less than 2 years, the last time she probably bought was less than 1,200. If nothing is done, then nobody, very few people can afford drugs, and the same thing extending to investigations. Very recently, the premier teaching hospital was on the news. The premier teaching hospital, you know, the premier teaching hospital in Nigeria. There was no light. The patients protested.
The patients.
It was the patients that protested. The teaching hospital could not afford, what's it called? They are, I think, on Band-Aid or something. And so the money was too much. So I think the distribution company disconnected the teaching hospital from national grid. So much chaos in the land. The government needs to come to the rescue of the healthcare system and to the rescue of the citizen. It's so simple.
Talking about chaos in the land, with this chaos you just mentioned, how can private partners really collaborate with the government at this point? What can they do? Because more like everything they do seems rather little. I mean, it's an effort, of course, but it seems not to really move no mountain nor a stone per se.
No. There must be stakeholders engagement and re-engagement. For example, I know in some teaching hospitals now, they have what they call public-private partnership. What does it mean? Virtually, there's private practice within the hospital, and that place tends to work better. You know, private establishments are known for their efficiency. That's just the truth. I always refer to this. The former Vice President Olubusayo, when he was to do a surgery on the knee, he left Abuja, didn't go to National Hospital, didn't go to Aso Rock Clinic, came to a private hospital in Lagos for the surgery. Private establishments are known for efficiency. Let me remind you, let me remind our viewers, when GSM was to start, there was O2 Econet, there was O3 MTN, there was O4, 0804 MTEL, that's NITEL, that's owned by government. Where is NITEL today? Why is that empty today? But the one owned by private, the Econet, of course, changed name severally. Econet is Airtel now, but it's still there. MTN is still there, but there's no MTEL again. Of course, before Glo came in. That is efficiency in private, and most of the time, inefficiency in government. So if we undo government establishment like private, it's going to work better.
Well, if we begin to discuss about the equipment used in our hospitals, I think we know the stories already.
Yeah.
But however, how do we begin to, like say, employ technology into our system? Because I think when it comes to the medical world now, technology has a large role to play in it.
Yes. The government only is not able to fund, but privates can support. For example, you need MRI. It will be very difficult. MRI is magnetic resonance imaging. It will be very difficult for government to purchase that for a teaching hospital. But do you know private organizations have that?
When you say difficult, is it the fact that...
Because, you know, there are a lot of things needed.
Okay.
Committing such huge amount on just one. Currently, I'm in Ondo. For CT scan, for MRI, yes, there are some private diagnosis center in Akure that has some of this high tech. But there's a private university with teaching hospital in a southwest state that has all this equipment. So virtually, that teaching hospital is servicing this whole environment. A private teaching hospital and government teaching hospital, they don't have this equipment. And so, some years ago, in this same Ondo, an organization, when Gani Fayemi died, in memory of him, the state government then, in collaboration with a private firm in Lagos, created a Gani Fayemi Diagnosis Center. That was the first time CT scan came to Ondo State. They had MRI. They had digital X-ray. They had mammogram. Of course, they have left to Ondo State. There was change of government. Then I think there was disagreement with the memorandum of understanding. They left. So we just need private. That's just my own opinion. To help in some of these things.
Well, if you describe the effect of the lack of this equipment on the healthcare system towards the patients or people who actually are coming to use this system, how will you describe it?
If I need to make diagnosis, okay. For example, somebody's slum was rushed to the hospital. Naturally, in every standard place, CT scan, we are even thinking of a stroke. The first thing that should be done is CT scan of the brain. You want to know, is it an hemorrhagic stroke or a thrombotic stroke? because the management is different. But unfortunately, the nearest place you can have that CT scan, as at today, I don't know tomorrow, is roughly 1 hour to where you are. Does even that patient or the relative, do they even have money for that investigation? Making it the second problem. Even if the doctor has made that request for CT scan brain, is there financial backing? It's not the doctor who will go and pay. It's the patient and the relative that will pay. You know what it means? There will be delay. They can start running helter-skelter to raise the fund. There will be delays. And of course, it can affect the outcome of that patient.
You did mention workforce, and you said our workforce are probably coming down at this point. You know, they are no more interested in living.
People are still interested. But
they're interested in living, but they are restricted.
Yes, they are restricted because there is no financial backing to live.
It's more like, I don't know if this is a good thing right now or a bad thing, but how can we make them not want to live anymore, since we have a financial constraint already?
Despite that, they are not happy. They are not motivated. Are you getting me? They are not motivated. If you want me to stay, motivate me to make me stay. It's so simple.
And the motivation would require money, you know, more allowances.
It's so simple. It's so simple. And making the work environment conducive for you. Hospital where there are supposed to be, for example, 20 doctors, 25 doctors, that you're having 8 doctors. Where there are supposed to be 200 nurses, you're having 18 nurses. You know, there's a challenge, major challenge. Apart from that, listen, that's why there's no way we'll talk and we'll not talk about the economy. Listen, I don't know the current exchange rate. But I'm not sure there's a professor of medicine. I'm not a professor, so I don't know. But I'm not sure there's a professor of medicine earning up to 1.5 million. Let me even say 2 million. There's even none. But let me even talk about 2 million. A professor of medicine. Assuming that's his salary package. Outside tax. Of course, there will tax other things. It will start to drop. And in UK, somebody like WordMade, health assistant, the carer that they do is like health assistant. Without any stress, can save £1,000. Do the conversion yourself. And a professor, with all the English, with all the surgery we do, earning maximally, it's even before tax. Even if it's after tax, 2 million. But a WordMade and savings is not even the salary in UK. And more than that, savings, not salary. There's no motivation. And so that's why people just want to go by all means. But if the exchange rate is near, is normal, so that means the 1,000 is so low because the exchange rate is not this floated, I don't know what they are calling it, the floating of the exchange rate that is causing all this thing. If I can make 2 million here and I go to UK, even if I'm making 2.5 million, naturally a lot of people will still prefer to stay home. But if I'm making 2 million here and somebody somewhere else is making 10 million, then we can't, every time he's calling me and he's telling me that, the only thing I will be thinking of is, when will it be my turn to come there? And that is what is happening currently.
And so quickly, before we go, let's talk about policy reforms quickly. Now, what policy do you think could be put in place to enhance or maybe promote collaborations and form of innovations?
Yeah, one, I think there should be stakeholders engagement.
Okay.
Different groups, NGOs, private, even communities. There are things they can do. That's one. Then the government should be able to set framework. This is the direction we want to go into. Three, they must strengthen health care institutions where medical personnel are being trained. It must be strengthened. You can't maintain the curriculum I used and you are still maintaining the same curriculum now.
No.
It can't work. There are new innovations that will be brought into the curriculum in line with current realities. If the government looks into all this, the system will improve.
Hopefully, we keep our fingers crossed, and we hope that one day they tend to attend to these issues, because for me, I think Nigerians have suffered on the part of the health sector. I mean, many have lost their lives, but we hope that things change for the better. Thank you for joining us this morning on the show.
And with that, we come to an end for Daybreak Africa for today. You have a wonderful day ahead. I remain Ezekiel Ogar.
And I am Angela Daku.